I got a question to ask, and I believe it's a myth to some extent, but not really sure. That if a heart disease is hereditary, what do you think? Is it unavoidable?
The majority of the hearts are not hereditary, but in the patients who are hereditary, we can't stop it. We can only slow down the process by lifestyle modifications. So is it like exercise, periodic checkup of the cholesterol, diabetes, hypertension, avoidance of smoking, alcohol, all these things can offset or slow down the process of heart disease. It cannot be completely avoidable. Then I have a very interesting case history I went through. Two siblings for 8 and 10 years of age.
Just 8 and 10?
8 and 10 years,
okay.
Had a chest pain. Since the family history, strong family history was there of a heart attack. So they investigated. Some EC changes were there. When they found that the two siblings had a major blocks in the heart and both had to be underwent coronary bypass surgery. So because by the time it was detected, the blocks has already developed. Patient had symptoms. So they had to undergo bypass because no angioplasty could not be done because not availability of small size stents. So bypass was done and they're doing fine.
What about sleep?
Yes, it's very, very important. You need at least a good 6 to 8 hours of good peaceful sleep to relax your mind, and body needs rest. You can't work 24 hours a day. So body needs also at the night, that is the best time to have a good sleep to reduce your stress and to reduce the incidence of coronary disease. There is the cycle change periodically, frequently, the body cannot adapt to it. So it should be like a certain, you need a good sleep to 6 to 8 hours. Sleep is very good enough. If it changes very frequently, by the time body adapts, the damage could have been done.
So we are talking about all this hereditary heart disease, how to avoid it, lifestyle changes and all. But I have a bigger question. In today's fast-pacing world, everyone demands more, right? Whether it's your work, your family and all. So what do you think? How stress plays a role in all this?
Stress plays a very major role in the prevent a heart attack. So even the stress can increase the rupture of the plaques in the blood vessels. This can trigger, if you see a lot of patients, young patients, the rupture of the plaque would happen, which was even if they evaluated previously, the angiogram was normal, suddenly they would have stress that would rupture a plaque and cause a heart attack. So stress should be avoided to set as much as possible, for which you need a good level of exercise, good sleeping habits, and take the life as smooth as possible. We should know our limitations and then go for it.
Okay, that's all, doctor. Nice to hear from you. Thanks a lot.
Thank you. Well, my pleasure.